And we are back again after this great report. Everyone, let's welcome Dr. Hind Alsharhan, consultant, family doctor and head of prevention programs unit at the Child Protection Office in the Ministry of Health. Doctor, good morning and welcome to the program.
Good morning. Thank you for having me. I just want to correct, I'm not family medicine, I'm a pediatrics and genetics and also assistant professor of pediatrics in College of Medicine, Kuwait University.
Thank you so much for this clarification. Of course, this and we will talk about the same subject. That is fortunate about modern gene-based therapies. Let's talk about this and why it's important to raise awareness about it.
Yeah, so gene-based therapies, those are type of therapies that target the root cause of a disease, rather than just dealing with the symptoms or the features of the disease. So you're going to the base of the problem and you're trying to focus how to manage it to eliminate the disease, hoping to eliminate the disease. We have a couple examples that we currently have in Kuwait, and there are a couple coming on the way. They're great. They're changing the natural history of such disorders that usually they're fatal, and now those disorders are manageable.
So what are the common genetic disorders, if we talk about the metabolic diseases in Kuwait?
So we have multiple common genetic disorders. We do have, in terms of metabolic disorders, we have one of the very common called VLCAD for short, which means a disorder of the way the body breaks down the fats. And this is common, for example, worldwide it's 1 in 100,000, while in Kuwait it's 1 in 5,000. So it's relatively common. We do have other genetic disorders that's also common, or compared to the rest of the world, it's the same incidence, like the disease that it was in the show prior to that. It's the spinal muscular atrophy, which is one of the also common disorders in Kuwait that we have now currently gene therapy for.
Yes.
Typically, this disease is fatal. There are several types, but usually the type 1, for example, is fatal. Now those patients can live, and we can manage those patients. It's something that have changed the natural history of this disease.
And this is something serious for the parents to take care of their children, so they need to know the signs, the early signs for this disease. What are the most common early signs?
So of course, so you need an early detection in order to benefit the most from such treatment. Typically, in a case when we have a newborn screening program, you'll detect those patients before showing any symptoms, and that's the perfect scenario, and you can initiate such advanced therapies. But for example, for that disease I was talking about, SMA, unfortunately we don't have it included in the newborn screen yet. So parents need to seek medical advice once they find any abnormalities, and such abnormality would be that the baby is not moving his limbs as it should be. He's very weak, lethargic, he can't hold his neck. Those are all signs that the baby is not poor feeding, for example. He can't suck well on the milk bottle, so that's all signs that this is something abnormal, and the parents should seek medical advice.
Do you think parents, they have the knowledge now that they see this child and they see this is something abnormal, as you said, not eating well, not moving properly? So do they need actually to go to the screening to detect, or maybe just watch their children, compare them with other kids?
Yes, so exactly. So you typically, for the young parent, this is usually tough on young, first parents, that they don't have anybody to compare with. But usually their grandparents or the aunts or uncles will tell them there's something wrong. Go check on your child. Yes. That's the typical history. But if this is an experienced mom who has other children, she would compare this new baby to her children, and she will come to us telling this baby is not acquiring the skills on time. So then we start working up the child. So it's really important for the parents to be oriented about the normal development of a child, when the child should be sitting, walking, talking. If you know what the age group, then you will detect if there's any alarming signs.
Yes. Also,
Kuwait, I can say we don't have it's not a common practice, the well clinic. A well child clinic, which means the child has nothing, is not complaining of anything. We're just going to check on the child. Okay, so there's a certain visits with the vaccination.
This is doing extra, actually.
Yeah, this is something extra, but we don't have this culture yet in Kuwait. The point of that is the pediatrician will examine the child, which should be a healthy child, check the weight, the height, head circumference, the development. If he's all fine, doing school like he's at school, doing well, this is all good signs, and then you do routine testing and so on. But if the child is detected early through those child visit that he's lagging or is behind, this is what will elicit a serial of investigation and referrals.
So I think the early diagnosis is the most important in terms of how to take care of this child. So how important is it to diagnose the child early than later in life, maybe after 6 or 10 years?
Yeah, so early diagnosis, it's essential, and it's the key to the right treatment and, the precise treatment plan. And it will completely change the trajectory of a patient's life or a child's life. Because if you're late in diagnosing the patient, there could be irreversible damages that happen to the child, including, for example, intellect. Intellect could be affected. He can be intellectually disabled because we were very late in diagnosing that child. And those damages you cannot reverse, even if you start the treatment. So that's why it's crucial to pick up those patients or those children early in life, even before showing symptoms. And that's the goal of the newborn screening program in Kuwait. We have a list of disorders that are typically treatable disorders to be picked up early, like the first week of life, before the baby showing any symptoms, so you can initiate the treatment plan and ensure they live a healthy life.
With that is autism, or is it out?
So autism is not included in that because unfortunately autism is the root cause of autism is still not understood. So we don't know yet.
It's not a gene disorder?
It's multifactorial. It's part of a genetic, familial factors, environmental factors. So we cannot pinpoint one cause that I can screen for.
Yes, I think Dr. Hind, and maybe you agree with me that in Kuwait we have a specific culture that you said earlier that a first-time mom will not know about the child because she couldn't compare it to the first one. So, but we have a fabric that the aunts and maybe the grandmothers, both sides, they will act like a doctor. Do you think this is something good?
Oh, definitely. We have this all the time. Yeah. Actually, we have parents coming to our clinic tell us, oh, my mom, which is the grandmother of the child, asked her to come because the grandmom thinks the baby is not doing well. But the mom, she thinks the baby is well.
So this is a problem?
It's not a problem. Actually, sometimes the grandma turns to be right, okay? But I'd love the grandma who asked to seek medical advice, not to tell the parent to do this and that.
She wants to feel involved.
No, yes. But sometimes what I see is the cautery, they cauterize the child, thinking that this will help the child. This is really, I feel it's really traumatic to the child. Yeah. They come with a lot of cautery marks because grandparents told them this is the first line of therapy. Yeah,
this is something that I thought it was good, but maybe it has some goodness in it. So Kuwait is introducing several new genes and enzyme therapies. Can you tell us about these?
Yeah, so the first gene therapy I believe that we had in Kuwait is called Zolgensma, is for the SMA, the spinal muscular atrophy disease. We have now a couple gene therapies also for blood disorders like the sickle cell and thalassemia. You have other also gene therapy for other neurological disease called MLD for short, or metachromatic leukodystrophy. There are more on the way coming. So this tells you how precise is the treatment coming, right? And that's why genetic diagnosis is really crucial. You need to know the gene, because to be eligible for such treatment, I need to confirm your diagnosis through a genetic testing.
Yes. Okay. And these screenings, is it optional on the parents or is it mandatory for?
So, unfortunately, we don't have a national premarital screening program that can detect such disorders or carrier status.
I mean, in everything, not in this.
It depends. So, for example, for the sickle cell and thalassemia, it's not part of the newborn screen yet. This has to be included because now we have also gene therapies. Yes. So same for SMA, it's not included in the newborn screening. So to have an effective therapy, you need to have this included in the newborn screening.
So let's talk about newborn screening and the situation in Kuwait. Tell me about it. What is it? And
so, okay, so newborn screening is one of the most powerful and effective public health program in Kuwait. It was expanded in October 2014. It includes around 22 disorders, endocrine disorders, metabolic disorders. Again, you're screening babies first week of life before showing any symptoms in order to detect them early and put them on the right plan and prevent long-term complications. Okay. This test is done for all babies born in Kuwait, regardless of the nationality, regardless where the baby was born, private or governmental hospital.
Yes.
Everybody is screened, 100% coverage. So this is really great. We are saving thousands of patients or babies every year. So that's really good. It needs to be expanded at one point, since we're having now new emerging therapies coming. So there are certain disorders that typically will need to be included, but this is to be studied again on the national level.
So there are many challenges, the families with the kids or children that are with a rare disease. They face many problems. So what do you say to support these families?
So there are a lot of challenges. First of all, you know, the diagnostic delay. So those children to be diagnosed, really they go through or they, you know, encounter the medical, you know, the challenges of the health system itself. Okay, there are challenges, and there's also some of the financial, social burden, you know, psychological stress, a lot of clinic visits, admissions. So this is all a burden. So I tell my family, we support you all the time because you're not alone in the journey. We're here for you. We provide usually we have a precise or accurate typically diagnosis with precise treatment plan and clear follow-up plan. We have multidisciplinary clinic care. Usually we try to have it in one hospital, one center, unless there are some specialists that they need to be seen in different hospitals. We provide them with medical sources that are trustable medical information. We try to connect them with other supporting families with the same diagnosis if we can, to provide a sort of support for those patients. Also, we try to collaborate with international centers for complex cases, either for just a consultation or actually we can also send the patient themselves to see them and evaluate them.
So this is good to hear actually for these families, because they need the support from the professional, especially that these some of these screenings that are newer here in Kuwait. So let's talk about the Kuwait Academy for Rare Disease, which is called. What is the mission of it and the impact that they are doing?
Yeah, so Kuwait Academy of Rare Disease is under the umbrella of Kuwait Pediatric Association. It was founded in February 2024 with the goal to raise awareness of rare disorders among the community and health professionals. Because believe it or not, some of those disorders doctors themselves never heard of. So it's good to increase awareness, because if you don't think of those disorders, you will never diagnose them, because you need to think of a disease in order to look for it and investigate.
Yes.
So it's important to raise awareness among health professionals as well. So we do that through you know, CME accredited symposium, lectures, webinars. Also we do public events. We have a lot of things on the social media from, you know, sources, medical information and posts. We try also to support the families through such you know, a platform, because believe it or not, we have a lot, because we don't have a foundation for usually for those patients, so they approach us to either connect them to other family members or asking certain questions, guide them through the therapies.
Yes.
So I believe we're just starting, but I see a lot of, you know, hope in this academy. Also, we're creating a website that has, you know, medical library in Arabic, because all the disorders, if you just, you know, Google it, rarely find something that's accredited or credible medical source for information in Arabic. So I'm trying to create a medical library in Arabic, arranged alphabetically, so that they can look up the
translation
disease.
of
Translation, usually from a reputable medical source.
Yes.
We're still working on the library. We're adding more disorders, but this is something also that we're trying to help patients with.
All the best of luck, because I think it's a new academy, and this is something really important and crucial for the health of these children. Unfortunately, we are out of time, but I have a last question. What do you say to families who live in denial? Because some of the children they have, they know that something wrong with them, but they deny that maybe it's a stigma or something bad to say that my child is sick.
Yeah, so we're here to support all patients. We have this thought, it's private. This information that we get, the genetic test we do, it's private, and we're doing this for the patient's sake. And the family, they're the most people who love their children. And in the beginning, denial is something expected and normal.
Yeah.
Usually it fades away as they see the children or they're suffering. And they will
yes,
come back to us asking for help. And they should know that this is private information, we don't share information, and at the end it's for the sake of the child.
Dr. Hind, indeed valuable information, and we'd like to thank you so much for coming to Good Morning Kuwait to tell us about this.
Thank you so much, you're welcome.
That was Dr. Hind Alsharhan, consultant and doctor and head of prevention programs unit at the Child Protection Office at the Ministry of Health. Now we'll continue Good Morning Kuwait, but after this break. Stay with us.